So, to reiterate what I started talking about previously in the first part, was that 1 in 7 women have postpartum depression symptoms the first year after childbirth in the United States. So, that's 600,000 women who get postpartum depression each year in the United States alone. So, that's 900,000 women each year if you count the 6 million women who have clinically recognized pregnancies annually that get postpartum depression, so that includes miscarriages and stillbirths. So only 15% of women with postpartum depression in the US receive professional treatment, whether of that if they can receive care or if they don't get diagnosed and are receiving professional treatment because of that reason. So the percentage of women with a recent live birth who reported experiencing postpartum depression in the United States. So postpartum depression rates range from 7.2 in Illinois to high of 20.4 in Arkansas. So not every single state reported or provided data for this report. So including the states that provided data, the average was 11.6% of women reported experiencing postpartum depression symptoms. So here we take a look at the map of the US, and it represents the percentage of women who reported experiencing these postpartum depressive symptoms. And you see the lighter blue states, they reported that it was less than 10% of women. And as you see, the scale increased to the darker navy blue. Those states reported back 13.8% or higher. So in regards to education and stigma, so if we take a look at awareness, we see that it's really important to educate mothers about the signs and symptoms of postpartum depression, and it's crucial because women need to know where they can get help and where to turn if they're experiencing symptoms. And overcoming stigmas is really important because postpartum depression has a negative stigma, and most women will turn away from seeking help because they see it as being a shameful thing and a shameful act to seek help for an issue like this. So if we take a look at postpartum depression in Nigeria, the incidence of postpartum depression is 27.2. Now, we take that number with a grain of salt because many women don't know what postpartum depression is in Nigeria, so they aren't going to report it because they don't know what it even is or that they have it. But factors that contribute to postpartum depression in Nigeria include intake of alcohol in pregnancy, history of postmenstrual dysphoric disorder, family history of perinatal psychiatric illness, history of childhood abuse, low income, poor social support, unplanned pregnancy, single motherhood, large number of existing children, domestic violence or relationship conflicts, and young age. So prevention programs in the United States versus in Nigeria. So postpartum depression and prevention and support in the United States. So as far as prevention goes, doctors may have the expectant mother complete a depression screening questionnaire during the pregnancy and after delivery. So mild depression can be managed with support groups, counseling, or other types of therapy, and in some cases, the doctor may recommend an antidepressant, which is safe even during pregnancy. And after the baby is born, your doctor may recommend an early postpartum checkup to screen for signs and symptoms of postpartum depression. And the earlier it's detected, the earlier treatment can begin. So if you have a history of postpartum depression, your doctor would need to know and may recommend antidepressant treatment or psychotherapy immediately after delivery. And support groups for mothers and fathers are available for those who are going through postpartum depression, and a support helpline is also available through Postpartum Support International. So there is new legislation in the US regarding postpartum depression. Most recently, the Bringing Postpartum Depression Out of the Shadows Act of 2015. So that's a new bill that is trying to be passed, and it would amend the Health Service Act to authorize the Secretary of Health and Human Services to make grants to states for screening, treatment for maternal depression. Um, and it would build upon the existing state and local efforts by providing targeted federal grants to assist states in developing programs to better screen and treat maternal depression. And in New Jersey specifically, the Speak Up When You're Down program started, and there was a budget of $4.5 million that was provided for a comprehensive program, including the establishment of a statewide perinatal mental health referral network. So that program is called Speak Up When You're Down, and it also includes a 24-hour, 7-day-a-week hotline for those who feel like they need help and want to speak about their postpartum depression. So on the path to prevention, so Nigeria, they're still working on a lot of preventative measures. Their mental health in general is very stigmatized in African countries, which impacts the way that Nigerians handle postpartum depression. As I was speaking to before, many women don't know what postpartum depression is or that it even exists, so it's less than 1% of Nigerian women. So in attempts to spread awareness, a prevention program was started called Postpartum Depression Awareness Program for Expectant and New Mothers in Nigeria. So it was started by a graduate of psychology, and it aims to address the stigma behind mental illness and specifically postpartum depression. And it educates women on the signs and symptoms of postpartum depression and encourages women to go get treated and specifically go to a hospital to receive help, because there are very few psychologists or any psychologists that are available to counsel these women. Thanks so much for taking the time to listen.